Hello and welcome back to this series of SYNLAB podcast. I'm Pasty Mokungah and I'm still your host. And with me here is the prolific Dr. Habeebu Muhammad. So far, so good. We've been discussing the topic active balls, maintaining prostate health. And we've learned so much about prostate health. We've learned how important the prostate gland is to the male reproductive system. We've learned that it grows with age. We've learned that with age also comes the predisposition to a lot of prostate health issues. We've learned that diet, lifestyle, your mental health goes very long ways to impact your prostate health. It has been such an educative series so far, and that's why I would recommend that you like this series, you go back and watch our previous episodes, comment on this, subscribe and share on YouTube and Spotify. Now, in this episode, we're going to be talking about the preventive measures and regular screenings for prostate health. Doctor, I'm going to ask, what are the recommended preventive measures for prostate health?
Okay, good lifestyle. That's reduction in alcohol consumption and cigarette smoking. Reduce stress. You need to sleep at least 6 to 8 hours a day. You also physical activity. That's exercise. You need to exercise. Sedentary lifestyle is not good for the prostate. Also, indiscriminate, coitus without barrier is also not the best for prostate. Your urine flow, you should also watch your urine flow. When you go to ease yourself, you look at the flow, so you'll be able to identify if there is a poor stream. You identify if there's incomplete voiding. You also want to know if there's increase in the frequency of going to urination. Is there blood in urine? Is there painful urination? All these factors you need to monitor so that you can know if there's any issue.
Okay, so along with that, I think this next question is going to be very interesting and one that people would want to know more about. How does being sexually active relate to the health of the prostate? We were having a discussion earlier, and I know it was mentioned that somewhere somebody alleged that you need to have a lot of sex to prevent. I think the figures were going as high as 21 times a month. How does that?
Actually, for the man, the older you are, the less you'll be able to have sexual activity. And also, this is a very controversial topic. There has been several research on this, but we've not really been able to pinpoint the relationship
whether
between.
Or not.
Yes, so far, sexual activity is not related to occurrence of prostate cancer. Like I have said once before, the most important factor in prostate cancer is the aging of the patient or of the person, the age of the person, and if there is family history. These are more important.
I don't know if our audience will be happy or sad to hear this because some people are using prostate as an excuse to go about.
Well, I don't really think it matters because it does not stop you from having, and it does not encourage it from coming.
So the main thing is to take your own steps.
Exactly.
To take the preventive measures.
Take a preventive measure, and sex is not one of the things you should consider.
Okay, so what are the different types of prostate screenings?
Okay, we have some prostate screening that is not very invasive, and you have the invasive one.
Okay.
Prostate screening technically are 3 types. You have what you can do by taking the blood sample. We call it PSA. PSA specifically means prostate-specific antigen, even though it does not only, characterize cancer. It can go up when there is prostatitis, when there is inflammation of the prostate.
Okay.
It can be up also if there is BPH. But with prostate cancer, PSA will go astronomically high. But there are some prostate cancer that the PSA still remain not
Low.
too high, low. So we cannot use prostate PSA to actually determine it, but we can use it to know that there's something wrong with the prostate. Another form of screening is using digital. This one is usually by a doctor. The doctor will put the hand per rectum, through the rectum, through the anus.
I think I've heard of this one.
Yes.
Even as you're saying, it is even sounding alarming to me.
Well, it's not too alarming. All you just need, the prostate is low. It's a low organ close to it's not too far from the anal canal.
Okay.
So you can just put your gloved hand and look at the architecture of the prostate. What we want to see is it enlarged? Is it craggy? Is it normally smooth? The texture, from the texture you can
tell
you can infer that it's most likely normal or most likely malignant. Then the third way is to look at it using an imaging technique, which could be MRI or CT scan. MRI is usually used more.
Okay, and this is not invasive at all?
It's not invasive. MRI does not even have radiation. It does not have ionizing radiation. It's magnetic resonance imaging. So you are able to see the picture of the prostate live, and you are able to know if there are nodules or there are no nodules, if the architecture is normal or if it has been deformed. So after using MRI, you can then, if you see anything that looks suspicious, you can then use needle to take from it. And taking, this sample is called biopsy. So it's the biopsy that now
will tell
us whether it is cancerous or not. From the biopsy, you do this histology, that you look at the cells that you took. So the cancerous cells, they have different characteristics from the normal cell. We're able to judge what it is.
So which of these screening methods would you say is the most effective?
Well, most effective, usually we use them in combination, but the easiest one for people to do is to take blood sample, because that one you can go to any lab and it's quite cheap, and you take blood sample. It's not really easy for people to go for clinical examination, because that you have to pay for consultation, you have to wait for consultation, But with PSA, you just walk into a lab like SYNLAB, then
but
they
the
take your sample.
PSA only tells you more or less that there's something wrong, meaning after PSA, there will have to be further tests.
All of them will just tell you there's something wrong. Even if you do finger use, it will only tell you there's something wrong.
I feel like not a lot of people will be open to that finger one.
Exactly. So the next one is imaging. Even if you do imaging will tell you there's something wrong. You still need to do biopsy to know what is wrong. So all of them are just pointers. The screening are pointers. The major
the biopsy.
Is the biopsy that would let you know if there's cancer or not.
Sir, please help us to know, at what stage should men start considering regular prostate screenings? When should they start going to the hospital?
So on average, at 40 years, men should start doing screening.
Okay.
However, if there's a family history, a strong family history, for example, the father and the brother or father and uncle, then the age should be earlier than 40, like 35, 30, because people who have strong family history are usually likely to have it earlier than, the average person.
Okay, so males in their 20s have nothing to worry about.
Usually, it's very rare to see prostate cancer at that age.
Okay,
very
rare. Should they wait until something is wrong? Should you wait until maybe you are having incontinence or something?
No. That's why we call this screening.
Okay, so just routine.
Yes, it's routine. Once you start screening at that 40, maybe once a year you do the screening.
Okay, I was about to ask how often, but once a year.
Once a year, yes.
It's not a once and for all type of screening.
No, it's once a year, but even that once a year still depends on the results. If the result is borderline high, then you do it a bit more frequently, maybe once in 6 months.
Oh, okay. So, how early can we detect prostate issues?
As long as we have the screening, once the PSA parameter is higher than normal, then we do further investigations and we can then detect it.
And it's better to catch it earlier than later?
Like every other malignancy, the earlier, the better. It's always easier to uproot a disease when it's just starting.
than later.
Than when
So
it has,
So with all of this, we've come to a point where we now know that prostate health is very important, and that preventive measures now include early screening, which is advised in males 40 and above. I might even say just 30 and above, whether or not, because how do you know? Like earlier in one of the series, I mentioned the fact that you might not know because here we don't have a good history of men going to the hospital.
Yes.
So even if you don't know that, even if your family does not have a history, you can just walk in for a screening, right?
Yes.
You can just walk into SYNLAB and get screened.
You can walk into a SYNLAB, and if the value is very low, for example, the usual value, the minimum or the highest value, the cutoff is 4 nanogram per ml. So if you have a value of 1, 2 at a very young age, you know that there's nothing to worry about. But if the value is like 5, then we need to do it a bit more frequently so that we can track it if it is. Then we may need to have other screening method done in addition, like the imaging, like the rectal examination, prostate rectum examination, digital examination. Yes, so we can be able to know if we need to go for that or not.
So what would you have to say to just men generally, given that your gender is known for not wanting to go to hospital, even for malaria, talk more of prostate. And it seems like when anything threatens the reproductive health of a man, they are scared. They will not admit that they are scared. They are scared. That's why they don't want to go and check.
Well, that's very true. That's our culture. The fact that we have tighter schedule now due to financial, state status, men usually do not want to have time for that, and they don't want to hear anything about that.
Yes.
Because they are scared of what will be the implication. However, it's very important for every man to know that when caught early, you can easily reverse the situation. So it's very important to go for screening so that if there's any problem, it will be very easy to rectify rather than wait for it to spread all over.
But I think we can assure them, like, having prostate health issues does not make you less of a man, or does it?
It doesn't, but we don't even want to have it. So it's better to track it early, and the way to track it early is to screen, so that even if when it's there, it can be reversed.
Okay, so even when it's there, it can be reversed.
It can be reversed.
That's a possibility that exists. Yes. That's good. And I do believe that our audience has learned a lot about this.
Yes.
I definitely believe, I'm looking at all of you people in your houses, that people are standing up to go for screening right this moment. And if you have people in your life, males in your life that are between the ages of, 40 and above, even 30 and above, I know that you will like this podcast. You leave a comment, and you more importantly share to them and subscribe both on YouTube and on Spotify, so that more people will hear this, more people will be educated, and more people will take their prostate health more seriously. We're not done yet. Stay tuned. We'll be right back with more education about prostate health.